Hi, and welcome to the second program of this Fit for Life series. Tonight's topic is pregnancy, and we have all the advice you will need to prepare for labor. A guide to fetal development. We will include nutritional tips, our exercise of the day, and our delicious recipe, especially for our new mums-to-be. So sit back, put those tired feet up, and enjoy the show. Being healthy before, during, and after pregnancy involves many different aspects of your life. So I've compiled a quick list to help you stay on the healthy side. See your practitioner before becoming pregnant. Start changing your food habits to include a healthy variety of foods. Exercise. Starting now will help you stay in shape during pregnancy, can lower your risk of miscarriage, and has been proven to help reduce labor complications and length. Educate yourself. Buy or borrow a book on pregnancy. Eat more fruits and vegetables. Stop smoking. Find a program to help you. Take a prenatal vitamin. They can be prescribed by your practitioner, or you can buy them over the counter. Ensure it contains 0.4 milligrams of folic acid. Ask your partner to join you on your new healthy habit changes. Track your cycles. Learning what you can about your cycles will help determine when you ovulate and when you conceive. These make for more accurate due dates. Ask your friends with children about pregnancy and parenthood. Avoid chemicals that could possibly harm your baby. You can find these at work, in your home, and just about anywhere. Be environmentally sensitive. See your dentist before you get pregnant and brush your teeth daily. Tell any medical professional that you may be pregnant or if you're trying to get pregnant. This can prevent exposure to harmful tests and chemicals if you are pregnant and don't know it yet. Stop changing cat litter. Remember, it can take up to a year to become pregnant. If you have been actively trying for a year or more than 6 months, and if you're over 35, see your doctor. Act pregnant. This includes not drinking alcohol, even while trying to conceive. There is no known safe level during pregnancy, and alcohol can cause birth defects. Announce your pregnancy when you are ready. Talk to your parents. What do you want to take from their experiences? Rest when you can. Nap. Try to use non-medicinal remedies for problems like nausea, heartburn, and constipation. Drink 6 to 8 glasses of water a day. Join a prenatal yoga or exercise class. Keep your prenatal appointments with your midwife or doctor, as this will help ensure that if you have any problems, they're caught early and kept to a minimum. Remember to add 300 to 500 calories a day while pregnant, and don't miss any prenatal classes available. This will inform you of just about anything you can expect in labor, the pain relief available, and also show you the facilities in the hospital. Review the signs of premature labor and warning signs for when to call your doctor. If you're decorating your house or a nursery, remember to avoid fumes often associated with paint and wallpaper. Babysit a friend's baby and learn a bit about caring for a newborn. Swimming is great in late pregnancy. It can help relieve a lot of aches and pains and makes you feel weightless. Take a breastfeeding class to help prepare you for the realities of breastfeeding. Stretch before bed to help prevent leg cramps. Continue to exercise even if you have to slow down. This will help you recover more quickly. Write a birth plan, something to help you clarify what you want or need for your birth experience. Share this with your doctor and midwife. Practice relaxation whenever you can. Try for at least once a day. Do pelvic tilts to help with late pregnancy back pain. It will help relieve your pain and even encourage the baby to assume a good birth position. Pack your hospital bag when you reach the 36-week milestone to make sure you have everything you need to hand when baby decides he or she is ready to arrive. Let's now inform all you mums-to-be about the care you will receive throughout your pregnancy. And joining me tonight is Nadine Delipiani and Natalie Lombard, both midwives with the St. Bernard's Hospital. Thank you, ladies, for being here with me tonight.
Thank you.
And what I want to know is obviously the care that pregnant women receive as soon as they know that they're pregnant. So we'll start with the first 12 weeks, the first trimester.
Like we recommended last week, obviously we recommend women to book as early as possible so we can get screening in as soon as possible. And normally you wouldn't see your midwife until about 10 weeks. And that 10-week appointment is the first contact you have with your midwife, so a lot of details are discussed then. And we can actually make an appointment for your dating scan, which is between 11 and 13 weeks.
Okay, so then we go on to the second trimester, and what care can we expect?
During this trimester, what's quite important is the first initial blood test, where we can obviously identify any potential problems. You'll also meet your consultant obstetrician if it's your first baby, or if you have any other medical problems. And you can also expect your 20-week anomaly scan, which is quite an important scan to have, which is where they look at the baby in detail, look at all the major organs, and also your baby can be sexed at this time.
Okay, so we have to be careful with that. Obviously, you'd need to know beforehand if the parents want to know the sex of the baby, or if they would like a surprise. Don't want to spoil the surprise. So the last trimester, when women are becoming heavier and more uncomfortable, and obviously just wanting to have their baby, what's the care then? Does that change, or?
In the last trimester, what you find is that we tend to see the women on a more regular basis. We tend to see them roughly around every 2 weeks. And mums who've had any problems in the pregnancy, or first-time mums, they get to see their consultant a second time to discuss any further concerns that they might have as well.
Okay, so thank you very much. I think we should be proud of the care we receive in Gibraltar. Thank you, ladies.
Thank you.
So, to talk about what pain relief you will have available when you get into labour, we have Nancy Lopez, another midwife from St. Bernard's, joining me here tonight.
Thank you for having
Nancy.
us.
And just let's see what is available as pain relief for all those mothers who are probably dreading the labour stage.
Well, you've got to remember that labour is a gradual process. So in the beginning, the contractions are quite mild. So you always want your pain relief to match the intensity of the contractions. So when you start off, we can offer something that's quite mild, like the TENS machine that you talked before earlier, or something like a bath. If you're still at home at this stage, you can have a bath at home, a warm bath that helps, or just plain old paracetamol that everybody has in their cupboards. As the labour progresses, and let's say that you're admitted to hospital, then we can offer things like gas and air, which is a mixture of two gases, just oxygen and nitrous oxide. And then if your labour is still intense and you want something a little bit more, we can offer the injections, which are pethidine and diamorphine. If you still feel that you need a little bit more help, always remember that the midwife will be there, you one-on-one, and will be providing massage and giving you advice on positions and mobility during the labour. If you still feel like you need that little bit more, you can have an epidural.
Okay, and epidurals are also used, obviously, for caesarean sections.
It's different. For caesarean sections, you use what's called a spinal, which is an anaesthetic, which completely numbs you from the waist down, whereas the epidural is something a little bit milder.
Okay, so you can have it as a pain relief and also, obviously, if
with the right combination of drugs, yes.
Okay, Nancy, thank you. So it's up to you how you want to give birth. If you want to be able to move around freely during labour, say so, and this will influence the way your baby's heartbeat is monitored. A monitor strapped across your tummy or attached to your baby's head will restrict your movements. Which position? Although most women choose to have their baby in a semi-sitting position in bed, there are other positions you can adopt during labour. Walking can speed up contractions and dilation of the cervix, but even standing helps, especially if you rock your pelvis from side to side. Kneeling on all fours is a position many women instinctively want to get into during childbirth, in the second stage of labor, leading up to the actual birth. Some women find an urge to kneel against their partner or beanbag or the edge of the bed, while others choose to squat. This is a good, if tiring, position as it widens the pelvis and allows gravity to speed up the process. And what do you think about being induced? If your baby still hasn't arrived a week or two after your estimated date of delivery, do you want the birth to be induced? Either a hormone pessary is inserted, which may be enough to start everything off, or a drip containing a stronger hormone is put into your arm. What do you think about having your waters broken? Artificially rupturing the sac of amniotic fluid around your baby can speed up labor, with some hospitals carrying out the procedure as a matter of course. However, as well as increasing the frequency of the contractions, it can also make them more painful. If you would prefer your waters to break naturally, mention this in your birth plan. What do you think about having an episiotomy? Sometimes it is necessary for a small cut to be made to the vagina to help your baby to be born. This is done with a local anesthetic and is stitched after the birth. And what do you think about having an assisted delivery? If pushing alone isn't going to get your baby out, ventouse or forceps may be used. A forceps delivery involves the doctor pulling the baby out while you are pushing with a piece of equipment not unlike a pair of large metal spoons. And in a ventouse delivery, a soft cup is attached to your baby's head using suction so he can be pulled out by the doctor as you push. What about having a cesarean? Although some women choose in advance to have a cesarean, sometimes an emergency cesarean is required, so your baby can be born as quickly as possible. There are various reasons for this, including the baby being in breech position, feet first, preeclampsia, or the mother and baby may be exhausted. Women who are to undergo a cesarean are usually given the choice of an epidural or spinal block, which means you are awake during the operation, or a general anesthetic. Do you want your partner to cut the umbilical cord? Do you want to be told the sex of your baby, or do you want to make the discovery yourself? Do you want your baby cleaned before he is given to you, or do you want skin-to-skin contact immediately? Do you want an injection to help contract your womb and speed up the delivery of the placenta? How will you feed your baby? If you are going to breastfeed, it helps to put him to the breast as soon as possible. Do you want your baby to be given vitamin K, either by injection or by mouth, to prevent a rare but serious blood clotting disorder? And who do you want as your birth partner? It is common to have your husband when you're about to give birth, but this is your choice. Some women prefer to have their mothers as their birth partner instead. Before the birth, many parents-to-be are now considering cord blood banking. I'm going to give you an insight on what cord blood banking really is and how stem cell storage can provide biological insurance for you and your baby. While preparing for a new addition to the family, many expecting couples are faced with all sorts of choices and decisions regarding the birth of their newborn. Parents-to-be face many decisions from the instant they know they're expecting, as planning for the child's future is one of the most fundamental responsibilities of a parent. Most parents will begin to put aside money for higher education, making sure their houses are baby-proof, ensuring their kids have all the proper nutrition, as well as a loving and nurturing environment. With the latest progress of science and technology, new ways to prevent and cure diseases have been discovered. One of the most incredible new fields of scientific research is stem cell preservation. Stem cells have the remarkable potential to develop into many different cell types in the body, serving as a sort of repair system for the body. They can theoretically divide without limit to replenish other cells as long as the person or animal is still alive. When a stem cell divides, each new cell has the potential to either remain a stem cell or become another type of cell with a more specialized function, such as muscle, red blood cell, or a brain cell. One of the richest sources of blood stem cells is found in umbilical cord blood, and it has been successfully used to treat over 70 different diseases, including leukemia, Hodgkin's disease, and sickle cell disease. Research conducted in labs allowed also that these stem cells can help to reverse symptoms of stroke by rebuilding the areas of the brain affected. Through cord blood banking, it is possible for families to preserve their own genetically unique cord after the birth of their child. It not only ensures the future of their baby's health, it also ensures the future of their family's health, as stored cord blood can be used for family members as well. The stem cells can be kept in storage for an indefinite period of time, and should they be required, they only need to be thawed and are then ready for transplantation. The collection of umbilical cord blood is a simple, safe, and painless process which takes just a few minutes. The procedure poses no health risks whatsoever to either the mother or child, and collecting the cord blood may occur after either vaginal or cesarean deliveries. Neither the baby nor the mother's pregnancy or birth experience is affected by the donation procedure due to the fact that the stem cells are collected following the birth of the child. Minutes after the baby's birth, the umbilical cord is clamped, cutting off the link between the child and the placenta. The amount of blood remaining in the umbilical cord and placenta, generally 3 to 5 fluid ounces, is then collected and immediately delivered to a cord blood bank for storage. Cord blood banks have medical transport companies that come to collect the sample and transport it to the lab. A blood sample from the mother is also taken at this point for testing. At the bank, the unit of cord blood undergoes processing and samples are dispatched to labs for various tests. The blood is then processed in order to isolate the blood stem cells and to prepare them for psychogenic storage. For more information, discuss this with your midwife and they will explain how to arrange collection. And though unfortunately there are no cord blood banks in Gibraltar, if this is an option you would like to consider, it is available in Europe and all arrangements can be done safely via the internet or phone. Eating a healthy, varied diet in pregnancy will help you to get all the vitamins and minerals you need. Here are some vitamins and minerals that are especially important. It is best to get vitamins and minerals from the food you eat, but when you are pregnant, you might need to take some supplements. But be careful with vitamin A supplements or any supplements containing vitamin A, as too much could harm your baby. Folic acid is important for pregnancy as it can help prevent birth defects known as neural tube defects, which can cause conditions such as spina bifida. You should also take a 400 microgram folic acid tablet every day while you're trying to get pregnant and until you are 12 weeks pregnant. If you didn't take folic acid before you conceived, you should start as soon as you find out that you are pregnant. You should also eat foods that contain folic acid, such as green leafy vegetables, brown rice, breakfast cereals, breads and margarines that have folic acid added to them. You need to take a bigger dose of folic acid if you have had a baby with spina bifida, if you have diabetes, are taking medicine for epilepsy, you have celiac disease. This, speak to your midwife or doctor about. If you want to get your folic acid or vitamin D from a multivitamin tablet, make sure that the tablet does not contain vitamin A. Vitamin D you will need to keep your bones healthy and to provide your baby with enough vitamin C for the first few months of its life. You should take a supplement of 10 micrograms of vitamin D each day. Vitamin D regulates the amount of calcium and phosphate in the body, and these are needed to help keep bones and teeth healthy. Not enough vitamin D can cause children's bones to soften and can lead to rickets, a disease that affects bone development in children. Only a few foods contain vitamin D, such as oily fish, fortified margarines, some breakfast cereals, and tara masalata. The best source of vitamin D is summer sunlight. The amount of time you need in the sun to make enough vitamin D is different for every person and depends on things like skin type, time of day, time of year, but you don't need to sunbathe. The amount of sun you need to make enough vitamin D is less than the amount that causes tanning or burning. If you have dark skin or always cover your skin, you may be at particular risk of vitamin D deficiency. Talk to your midwife or doctor if you're worried about this. Iron. If you are short of iron, you'll probably get very tired and may suffer from anemia. Lean meat, green leafy vegetables, dried fruit and nuts contain iron. If you'd like to eat peanuts or foods that contain peanuts, such as peanut butter, during pregnancy, you can do so as part of a healthy, balanced diet. Unless you're allergic to them or your health professional advises you not to, many breakfast cereals have iron added. If the iron level in your blood becomes low, your GP or midwife will advise you to take iron supplements. Vitamin C. You need vitamin C as it may help you to absorb iron from food. Citrus fruit, tomatoes, broccoli, peppers, blackcurrants, potatoes, and some pure fruit juices are good sources of vitamin C. If your iron levels are low, it may help to drink orange juice with an iron-rich meal. Calcium is vital for making your baby's bones and teeth. Dairy products with fish, edible bones such as sardines are rich in calcium. Breakfast cereals, dried fruit such as figs and apricots, bread, almonds, tofu, a vegetable protein made from soya beans, and green leafy vegetables such as watercress, broccoli, and curly kale are other good sources of calcium. If you're vegetarian or a vegan, you need a varied and balanced vegetarian diet. It should give you enough nutrients for you and your baby during pregnancy. However, you might find it hard to get enough iron and vitamin B12. Talk to your midwife about how to make sure you're getting enough of these important nutrients. If you are vegan and you cut out all animal products from your diet, or you follow another type of restricted diet, such as gluten-free, because of food intolerance, example celiac disease, or for religious reasons, talk to your midwife or ask to be referred to a dietitian for advice on how to make sure you are getting all the nutrients you need for you and your baby. Be aware of the foods you should avoid. Most women suffer from nausea at some stage in their pregnancy, so today's recipe is a delicious carrot and ginger energizer, a double whammy to ease your nausea and also give you the energy you need. For thousands of years, ginger has been considered a healthy food. The main active compounds are terpenes and gingerols, which have anti-cancer properties and have been shown to destroy colon, ovarian, and rectal cancer cells. Gingerols also have a powerful anti-inflammatory action, and ginger has been shown to improve pain and swelling in up to 75% of people with arthritis. It also improves mobility. It may also ease migraine tension. Ginger has long been used as a remedy for nausea and to aid digestion, relaxing the intestines and helping to eliminate flatulence. During the course of pregnancy, strengthening the abdominal muscles is critical to help support the growing uterus, decrease lumbar compression, and reduce pelvic pressure. Women who practice safe abdominal strengthening during pregnancy have less low back pain, less pelvic pain, better mobility, easier deliveries, and faster recoveries. A hormone is also present called relaxin. The purpose of this hormone is to increase mobility so that the tissues of the body are able to accommodate the rapid fetal growth and prepare for delivery. At about 20 weeks, and often sooner, for a second pregnancy, the rectus abdominis will begin to separate along the linea alba, with the two rectus halves moving laterally. This is called a diastasis recti. This is a normal occurrence during pregnancy, and this will occur in almost all women. However, when the abs separate, there is less support for the lower back, which often results in an increase in low back pain or other discomforts. Safe abdominal strengthening during pregnancy should work the transverse abdominis, TVA. Training of the TVA supports the uterus, and a well-toned TVA will help keep the rectus halves closer together and prevent the separation from opening excessively. Therefore, it also helps women prepare for delivery, as one of the roles of this muscle is to assist during forceful pushing. Pregnant women are most comfortable in sitting and quadruped positions, especially as the pregnancy progresses. Let me show you the seated abdominal. Start seated with body weight centered over pelvis and shoulders aligned over pelvis. Practice pulling belly button to the spine without allowing the rib cage to shear forward. You hold for 30 seconds. Begin with a breath and expand the body, then exhale and move the belly button towards the spine. Hold it here for 30 counts and end with a breath. The second exercise, on hands and knees, is a beneficial position as it takes the weight off the pelvic floor and helps to increase perineum circulation. Start on hands and knees with hands lined up with the shoulders and knees lined up with your hips. The spine should be neutral. If wrists are a problem, use the fists on the floor. Pull your belly button to the spine, maintaining neutral spine. Repeat 50 to 100 reps. Okay, so pull your belly button into your spine and release. Sadly, that's all we have time for, but join me next week when we will be talking all about babies. See you soon.